This episode is brought to you by the world's first reposado from Tequila Herradura. Made with slow-cooked, hand-harvested agave sealed into oak barrels and aged 11 months. Before being enjoyed in your glass. Experience the world's first reposado, Tequila Herradura. Please drink responsibly. Responsibility.org. Tequila Herradura. 40% alcohol by volume. Imported by Brown-Forman, Louisville, Kentucky. Herradura is a registered trademark. Copyright 2025 Brown-Forman Corporation.
This episode is brought to you by Amazon. Sometimes the most painful part of getting sick is the getting better part. Waiting on hold for an appointment, sitting in crowded waiting rooms, standing in line at the pharmacy, that's painful. Amazon One Medical and Amazon Pharmacy remove those painful parts of getting better with things like 24/7 virtual visits and prescriptions delivered to your door. Thanks to Amazon Pharmacy and Amazon One Medical, healthcare just got less painful.
Halliday presents, in the red corner, the undisputed, undefeated Weed Whacker Guy. Champion of hurling grass and pollen everywhere. And in the blue corner, the challenger, extra strength Halliday. Eye drops that work all day to prevent the release of histamines that cause itchy allergy eyes. And the winner by knockout is Halliday. Halliday, bring it on.
Man, you are one pathetic loser.
Well, that's because you're an idiot.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease. So I'm paging Dr. Steve. Dr. Steve.
From the world-famous Cardiff Electric Network studios in beautiful downtown OJ City, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider, gives me street cred. The whack alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And back from sabbatical, it's Lady Diagnosis. Hello, Lady Diagnosis.
Hey, Dr. Steve.
Now, this is a show for people who have never listened to a medical show on the radio or the internet. If you have a question you're embarrassed to take to your regular medical provider or you can't find an answer anywhere else, give us a call. 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine, at DrScottWM, and at Lady Diagnosis. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything in with a grain of salt. Don't act to anything you hear on this show without talking over with your healthcare provider. Don't forget stuff.drsteve.com. It's stuff.drsteve.com. You can check out the Roadie robotic tuner. And it's a great gift for anyone who has a stringed instrument. They have one for bass. They've got them for guitar. You can tune your mandolin. Dr. Scott and I tuned his mandolin with one time. It's a great addition, and they're very inexpensive for what they do. So check that out at stuff.drsteve.com or roadie.drsteve.com. The other thing you can buy is Wet Brain, the card game. It's a great party game based on presidents and assholes. And it has, if you're into the Dabbleverse, it's got all your Dabbleverse friends in there. If you're not, which is probably the majority of you, it's totally fine. You're still going to enjoy this game. So check it out, Wet Brain, at stuff.drsteve.com. And then check out Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. He's getting ready to shut it down. Why, I don't know. I think it's sadly ridiculous. Now I'm going to have to start paying him because I was paying him in plugs.
Money.
And So no, I'm not paying anybody shit. But we will. You know what I will do though is I'll do your voice on Super Tip, and anybody uses your Super Tip voice, I'll give you the money from it. How about that?
Oh yeah,
yeah. That might be something. Again, we got to get the Super Tip system working though. I'm not sure what's going on. I swear I had it working.
Right on.
And probably there's a lot of people out there going, oh, thank God, because they hate the Super Tip system. But the way we'll use it will be very tasteful. We'll mostly play them at the very end of the show for people who don't, appreciate the voices. But there can be some really funny stuff with that. And one of them is my voice.
Okay.
And so I will call into like Tukey's show and go, and you'll see my face on there, and I'll pay for it, but it's using my voice. It says, finally, my voice can be heard, and I have to pay to have my voice heard on this show, and stupid stuff like that. But I can comment, and but not actually be on the show.
So it shows a picture of you while you're
Yeah,
talking?
yeah.
Oh,
it's
fun.
like the mouth doesn't move, but the thing kind of vibrates
Gotcha.
along with the words.
Oh, my.
You'll see. It's actually very clever. Mr. Melton, who invented this system, is a genius, and lots more people are using it. And instead of taking 30%, like YouTube does, and paying you once a month, he takes 10%, and you get the money immediately.
Huh. That's good.
So, and it's cheap. It's like $5, something like that, but it's fun. All right, so there you go.
Cheap fun.
Yeah,
Cheap fun.
yeah, I like cheap fun.
Cheap fun.
Check us out at patreon.com/weirdmedicine. All the stuff that you don't see elsewhere goes there, and they get first whack at all the video things and all the other things that we're doing. I was supposed to go to Detroit. I don't know if I'm going to be able to go. I've got a new sort of health thing going on, and this is what happens when you're 70. It's like traveling around and doing. I took my son to. He graduated first in his class in college, and very proud of him. And he wanted to go to Summer League, which is NBA, basically kind of. I don't know what you would call it. They have a tournament.
It's off season.
It's off season, yeah, and they put a lot of the people who don't get to play and the new players and stuff like that.
Gives them a chance to kind of figure out who's who and what's what.
And like LeBron James's son was playing, and so LeBron was there, so Bronny James was playing, and there are a lot of people that don't get to play as much, or new people that they've just recently drafted and stuff like that. Yeah. But you're right there. I mean, if you're in the smaller amphitheater, you're 5 feet away from people. And these are people, Liam has encyclopedic knowledge of all of these people. And he even recognized like one of the announcers. Oh, that's the guy that, and he knew his name and everything about him and who he played for before he announced. So he went and talked to him, and Liam's very engaging when he wants to be.
Oh, yeah.
And so we did that, but we're in Las Vegas. Now it's 114 degrees.
Yikes.
Ooh.
And here I am, almost 70 years old. Oh, he got backed off on playing blackjack at the plaza, by the way.
Oh, did he really?
Oh, yeah. Yeah, I'll tell you that story in a second. But so 114 degrees, running around. I was up for 36 hours straight because you're leaving there, and it's what we were going to do was the red eye. So our plane was supposed to take off at midnight.
Oh, geez.
Didn't take off at midnight.
Oh,
so
God.
we missed our connecting flight. And then in the middle of this flight, I'm trying to get some sleep, right? Because I've been up. Now, midnight there is 3 a.m. our time. So, and then at about 1:30, the lights come on. They say, are there any medical professionals on board?
Right.
Oh, no.
So what was going on was people were getting dehydrated, but when you're out there, 114 degrees, you're running around. It feels like, just imagine, if you've not been out there, imagine somebody taking a hairdryer on high and just blowing it in your face. That's what it feels like. And but it's so dry you don't sweat. So people are like, it's hot, but I'm okay. Well, they're sweating. you do sweat, but you don't accumulate it. It immediately evaporates.
Mm-hmm.
And so they're becoming dehydrated. They're not drinking enough water, or they're drinking too much alcohol. And then they get up to go to the bathroom after sitting on the plane for an hour and a half, and clunk.
Jeez.
Yep.
Yeah, there you go.
And it was happening right and left on this flight.
Dropping
Oh,
like
my
flies.
God.
Oh, my.
Yeah, so I attended to at least 2, and one had to be, transported once we landed, transported to the hospital. So I got no sleep, and here I am. This isn't good for you. But I'm okay. When I'm out there, I'm usually putting these younger people to bed. They're like, "Oh, I'm tired." I'm like, "No, we're gonna
party." Yeah.
But it does catch up with you.
Yes.
And so I think my traveling days may be over when it comes to like performing and stuff. I'll go see people and hang out, but I'm not getting on stage and stuff anymore. I'm slowing down, and it just, I think I'm done.
Well, you can take a couple days for that trip instead of one. That might help.
Yeah.
That's a little common sense.
Oh,
I'm
well,
sorry.
okay, so let me tell you about, I have been doing that. I've been taking a
good.
buffer day before and after and all that stuff, but it's still, I don't feel like I perform well.
Gotcha.
Anymore. If I ever did, I don't feel like I do.
Maybe a little shot of Cialis before you go on stage.
Oh, yeah, that might help. Just sit up there with a raging boner.
There you go, Dr. Steve.
Might be it.
It's onto something there.
I got to tell you about Liam
let's
getting
hear it.
backed off. So we found a table at the plaza where they do 2-deck blackjack instead of 6. There's 2. Why would you ever do that?
I don't know what that. What does
Well,
it
they
mean?
only have 2 decks instead of 6 decks.
Okay.
So if you're card counting, it becomes very easy.
Oh, okay.
Because normally you have to divide by 6, because, or however many decks are left and all that stuff. Well, with this, you're only ever really using 1 deck.
Huh. Okay.
So, and the essence of card counting is that if a bunch of low cards come out, then there's a preponderance of high cards, and those are actually good for the player.
Gotcha.
So, because the dealer has to, you can hold on 12, the dealer can't. Dealer has to hold on 17. So, and there they have to hold, if they have a soft 17, in other words, a 6 and an ace, they've got to draw. So, they would, it's more likely they're going to bust if there's a lot of high cards in the deck.
Okay.
So anyway, and that's the essence of card counting.
Gotcha.
Well, stupidly, there are these drunks at the table that were cussing the dealers and demanding comps, and they were betting, table maximum, which was $2,000 and all this kind of stuff. And then here we are. And Liam lost about 5 hands in a row. He doesn't like losing, so he said, I'm going to sit out a couple of hands because I'm losing. Well, turned out the count was really low, which is not advantageous for the player. And the eye in the sky notices this. Well, he was only going to sit out for like a hand or two, but then when he tried to come back in, the dealer said, no, you can't come back in until the shoe is done. Now I understand why, because it's they don't want people sitting out and then coming back in when the count becomes advantageous.
Gotcha.
But they made him sit out several hands. Well, the drunks left, and it's just me. So we're sitting there for like 10 minutes while I'm running the shoe out, right? Well, okay, then he comes back in. He loses a hand. He's got probably $150 worth of chips left, and he says, I'm just going to go all in. And he goes all in and he wins. And then the pit boss comes over and just goes, yeah, you can't play here anymore. And so I'm like,
wow.
Well, I said, he's not smart enough to do what you think he's doing, which is a lie.
Liar.
Yeah, I was lying. But
he could teach the class.
I did. Right. Well, that's true. And he is actually teaching class. But I wrote an email to the casino manager, very nice guy named Christian. He's the head of the table games. And I said, this is what happened. There were these drunks at the table, and then Liam, was losing hands, so he sat out, and then they wouldn't let him come back in. Then when he came back in, he just went all in, and he won, and then they backed him off. And he emailed me back right away and said, was your son the guy with the long hair and the Grizzlies hat on? Of course, he's a Memphis Grizzlies fan. Yeah. And I said, yeah. And he emailed me back. He said, listen, if he isn't card counting, he's certainly count aware, because when he sat out, the count was 2. And when he came back in, the count was like 10 or 12. And he said, he's just too good for us. And so they've got an eye in the sky. They're counting with you. So if you think they're not, if they're just watching you play, no, they know what the count is. I don't know if they have AI that's doing it or if there are people up there that just know how to card count. But they're watching for people when the count is high, increasing their bet. That's how they're catching them now.
So I wonder if he was drinking more, if they would have even caught on. Do you think?
I don't know. But the thing, I said, listen, I get it. It kind of irks me that the drunks get to come back and play because they were abusive. Because when Liam got backed off, he still tipped the dealer.
Well, he's a good kid, though.
Yeah. And the guy...
And manners.
And I think they're used to getting cussed out because I said, you know what? It's fine. I understand. It probably happens a lot at the 2-deck game. Okay. And I'll see you at the 3-card poker table instead. And he emailed me back, you're a gentleman and a scholar. You know what? Next time you guys come back, let me know. We'll host you. So not only did Liam get backed off, but now they're going to comp our next visit, which that I can't imagine that ever happens. Particularly with somebody like me that, I'm betting if I bet $1,000 a day, they're getting more action than they normally would. So, but that was a fun experience. I was at first thought it was hilarious, and then I got kind of mad about it because of if it hadn't been for those other guys, because they're comping them dinners at the steakhouses
just to get them to shut up.
Well, and then
really?
But they knew they were going to get their money back.
Yeah, but just to shut them up.
Yeah, they did. They shut them up.
Yeah.
But they were driving the dealers and the pit bosses crazy, these two guys. So they just finally comped them I think Scott's right, to shut them up, knowing they were going to come back and they would get every penny of that money back because they were betting stupid. And so, Liam's betting small, but he's betting smart, and he's more dangerous to them, I guess. So anyway, that was that.
Wow.
Yeah, it was crazy. But we had a great trip. And I saw a lot more basketball live than I've seen in ages because I didn't want him to have to go by himself.
Squeaky shoes.
Yeah, it was fun, though. Yeah, we had a great trip. But, if you're going to go to Vegas in July, hydrate, hydrate, hydrate. You don't think that you're sweating, but you are, and you're becoming volume depleted. And if you sit down for a long time and stand up, you may keel over. And then you have to have some,
irritated doctor,
radio doctor come and help you out.
Damn it.
I know. So anyway.
What comes to mind when you picture the perfect roommate? One who comes when you call, one who doesn't forget to lock the doors, maybe one who doesn't steal your milk just a little bit at a time, hoping that you won't notice. At Apartments.com, they understand that when it comes to roommates, a pet can be your best bet. They're easygoing, they eat what you serve them, and they never clog the toilet. And that's why Apartments.com has the most pet-friendly rental listings on the internet. And with instant alerts, you'll know the moment that your perfect pet-friendly place becomes available. Apartments.com has so many features like 3D virtual tours, the ability to save your favorite apartments, and with over 1 million places to rent, you are absolutely going to find the right place for you. Apartments.com knows that moving can be stressful, but by giving you options, filtered searches, and more, they can help take away some of that stress. When I need a new apartment, I will definitely need a pet-friendly choice. So if you guys need a place that's pet-friendly and human-tolerant, check out Apartments.com, the place to find your pet-friendly place. Thanks, Apartments.com, for sponsoring the podcast.
Hey, it's Sydney Sweeney. I'm not here to tell you to buy American Eagle jeans. And I definitely won't say that they're the most comfortable jeans I've ever worn. Or that they make your butt look amazing. Why would I need to do that? But if you said that you want to buy the jeans, I'm not going to stop you. But just so we're clear, this is not me telling you to buy American Eagle jeans.
Sydney Sweeney has very jeans.
You see what I did there, right?
On WhatsApp, no one can see or hear your personal messages. Whether it's a voice call, message, or sending a password, To WhatsApp, it's all just this. So whether you're sharing the streaming password in the family chat or trading those late-night voice messages that could basically become a podcast, your personal messages stay between you, your friends, and your family. No one else. Not even us. WhatsApp. Message privately with everyone.
Make your next vacation unforgettable on Royal Caribbean's newest ship, Star of the Seas. It's everything you've loved about every family vacation you've ever been on, with mind-blowing thrills at the largest water park at sea, 7 onboard pools for every level of chill, more than 40 ways to dine and drink, and even more to enjoy at our award-winning private island, Perfect Day at Coco Cay. This is the new Star of the Seas. Click or tap the banner to find out more.
A massage chair might seem a bit extravagant, especially these days. 8 different settings, adjustable intensity, plus it's heated, and it just feels so good. Yes, a massage chair might seem a bit extravagant, but when it can come with a car, suddenly it seems quite practical. The all-new 2025 Volkswagen Tiguan, packed with premium features like available massaging front seats, it only feels extravagant.
So there you go. That was a fun trip. All right. You have any questions there, Dr. Scott?
I got a couple good ones.
Okay.
I surely do.
All right.
How about let's do, from Saxon. Keto fixed my bad cholesterol, but made my low good cholesterol worse. Is that normal?
Okay. Yes, it is normal. The problem with HDL and ketogenic diets, and we talk about ketogenic diets, we're talking about low carbohydrate diets where you're burning fat because you can no longer burn carbohydrate stores in your body because you've depleted them all. Okay, so we have 2 ways of storing energy in the body. One is to store carbohydrates. A lot of it's in the liver, and but other places, muscle tissue and stuff like that, and then fat. But when we want to lose quote weight, what we're really saying is we want to lose fat. And so if you eat a low carbohydrate diet, you will burn all the carbs that are in your body. And when that happens, then you have to metabolize fat for energy. And so now you're burning fat, and then you will produce these things called ketone bodies, which are detectable in the urine, and that's when people say, I'm in ketosis. Now, the problem is the ketogenic diet impact on HDL is complicated, and it can vary. There are some studies that show that the ketogenic diets actually increase HDL levels, but it's not universal. Others show no significant change, and others show a decrease. So it tells me probably doesn't have a huge effect. But in some people with specific genetic predispositions, it actually drop it. The overall effect on heart health is still being debated. We don't care so much about what the HDL and the LDL look like. What we care about is the outcome. So if I had a drug or a diet that would make people's cholesterol look like shit, but it would reduce heart attack and stroke, I would still do it because the cholesterol is what we call a secondary endpoint. In other words, it's indirect. You're looking at reducing the cholesterol in the hopes that you reduce someone's heart attack and stroke.
Yep.
So did you have something more you wanted to say about that?
I was just going to say kind of the same thing. It certainly can have a genetic component. Some people just genetically have. And
now,
plus,
compared to a high carbohydrate diet, it's almost certainly more effective for reducing heart attack and stroke because the high carbohydrate diets result in insulin peaks and then
a lot of inflammation.
Inflammation, insulin peaks, and then low blood sugar, which then results in insulin insensitivity as the body reacts to that and turns the sensitivity down, et cetera, et cetera. You can get reduced triglycerides through a properly done ketogenic diet. And if you increase the HDL and decrease the LDL, you can improve the ratio, and that's actually good. So, but there is a variable LDL impact, and some people, it makes it worse. And there are these people that are called hyper-responders. They have this dramatic increase in LDL cholesterol on a keto diet, and that is based on your genetics. And the only way you'll know if you're one of those is to get a blood test done, after you've started a ketogenic diet.
Mm-hmm.
But, there's no consensus on what a ketogenic diet does for cardiovascular health.
Yeah.
There is consensus on the vegan diet,
Mm-hmm.
that it does improve outcomes and reduce heart attack and stroke. So there you go. But I'm not doing a vegan diet.
No,
I'm sorry.
Balance. It's all about balance.
Now, Bonnie McFarlane is a vegan. She's very, strong proponent of vegan lifestyle and stuff. And she works out and all that stuff. She ought to live forever.
Yeah.
Yeah.
Or at least until she doesn't.
Right.
Wisdom.
Well, as Willie says, there's a lot more old drunks than there are old doctors. So.
Well, that's true.
There you go.
That's true.
Ooh, that's funny.
All right. How about another one?
Sure.
Is there a downside to taking stuff like Prilosec long term? So, especially if you deal with GERD or similar problems.
Yeah.
So, a couple things.
Who's that from?
That's from the One Pun.
Well, at One Pun, I wanted to tell you 3 tons of hair were stolen from a wig factory the other day. The police are combing the area. Well, there you go. Coleslaw. Coleslaw, everybody. All right, go ahead.
Oh, my.
Sorry.
But, so taking those medications certainly can help acutely with GERD reflux.
Yeah, of course.
They're
proton. They are proton pump
they're
inhibitors.
Lifesavers, but we encourage them to try to get off them as quickly as you can because it can lead to decreases in certain vitamins and minerals, specifically calcium.
There you go.
And certainly
myself a bell.
Yeah.
So if you have decrease in calcium, that's going to result in
possibly osteoporosis,
which can result in
osteoporosis,
osteoporotic bone fractures,
of course,
right.
bone loss and breaks. Yeah, and that's the biggest thing is those medications can decrease your ability to absorb other nutrients, not just calcium.
Yeah,
but so
I take a double dose of PPI, and I have got to this year work on getting off this shit. It also increases there is suggested increased risk of dementia, cardiovascular events. Because you are increasing the pH in the stomach, you're losing out on one of the defenses against certain bacteria, including Clostridium difficile
C. diff,
or C. diff.
Sure.
You've got Cardiff is a potato. Corn diff is an ear of maize, but C. diff is voluminous watery diarrhea. So there you go.
There you go.
Dabbleverse people. Vitamin and mineral deficiencies, PPIs interfere with calcium absorption, potentially leading to, as Dr. Scott said, decreased mineral density and increased risk of fractures. And reducing that stomach acid, again, can cause problems. And you can increase the risk of community-acquired pneumonia as well.
Yeah.
So vitamin B12, magnesium, and iron can be, absorption can be affected as well.
So a couple things other than the PPIs, real quick. And I know we've talked about it before, but it's really important to take these if you need them. But try to adjust your diet and the pH of your stomach so that you don't need them forever and ever and ever. Big thing: warm foods, warm drinks. Try not to eat a lot of stuff that's raw. It's just the harder something is to digest, the harder possibly the more acid you've got to produce, the slower your digestive tract is, and we call it gastroparesis or slow movement of the peristalsis. Through the colon. The slower that is, the worse it is, and the more acids produced, the more you're going to need. So bowel movements, daily bowel movements, good bowel habits, hydration, all these things are really important. A couple other things, not drinking a lot of water when you eat sometimes will help to your body to break down the food more quickly instead of diluting the acids with water. So
I know for people with dumping syndrome, they tell them not to drink.
Yeah, I like to tell people not to drink it, or just a little bit of water when you're eating, to try and let that food get out
Yeah. Dr. Scott advocates not drinking cold stuff if you have this problem too, right?
Yeah,
because that paralyzes the stomach to a certain degree. Or it
slows
it down.
Slows it down, yeah. So any way you can increase the gastric emptying, the movement of your stomach is really, really important.
Yeah.
And even simple things like little massages and even some herbs that you'll get in certain restaurants like fennel. Fennel is a warmer, can help your stomach to be warm and move a little bit more quickly. Ginseng. What else?
Ginger.
Ginger.
Yeah.
Yeah, little ginger is always good. That's those things can help warm your stomach and help to propel the food out of your system.
Interesting.
How about astragalus?
Astragalus is
God damn, I love that.
God damn you for bringing that up.
Shot of
He's a
astragalus.
fucking idiot. He's
So
a fucking idiot.
There are a lot of ways. I'm not saying those PPIs are to never take them at all.
No,
Because I took them myself for years, but I haven't taken one in a year at least.
Really?
Yeah. But the biggest thing I've done is I've stopped having carbohydrates for breakfast.
Yeah.
I have 40 grams of protein, pure protein in the morning, and nothing else.
How are you getting that pure protein in? Because
I
that's
have
like 12 eggs.
I have a protein. It's a plant-based protein powder that I found on the internet, and I love it. It's a pea protein based, and I tell you what, just keeping blood sugars normal, triglycerides normal, but most importantly, the movement of the stomach normal.
When you say pea, you mean the vegetable, not urine.
That's correct. Yes.
Right.
The pea, the vegetable. That's correct. I don't want
protein
urine
derived from urine.
No, negative.
Well, I got some pea protein, don't you know?
Give me the pea.
Shirley wasn't good.
Well, she surely wasn't good. So my plan is I take 2 30-milligram lansoprazoles every day. That is, and I've been doing it for years. And I have got to get off of it. And
I can help you, Grasshopper.
Okay. All right. I'm
I've
willing
got
to
your
try it.
herbs.
Now,
I've
I
got
also
your
take
herbs.
famotidine on top of everything else. Now, so you could say, well, okay, instead of a PPI, proton pump inhibitor, I'm going to take an H2 blocker.
H2, yeah.
And so the proton pump inhibitors work by actually preventing a quantum object, which is a naked proton. They're 3-bound quarks, and somehow we have channels that only allow 3-bound quarks to pass. It's crazy. They have to be charged too. It doesn't work with neutrons; only works with protons. It's insane.
That is weird, isn't it?
I don't even know what you're saying.
Exactly. That's what's crazy about it.
Yeah.
But for millions of years, dinosaurs had proton pump inhibitors. I mean, had proton pumps because they had to digest stuff.
Yep. It's crazy.
Body's amazing.
It is incredible. So before we even knew what quantum physics was, we have mechanisms in our body that can manipulate quantum objects. Well, anyway, so that's what the proton pump inhibitors do is they kill those proton pumps. And when they do, they kill them for 24 hours, and then you continually make new ones. And then the H2 blockers block histamine at the level of the stomach. So H1 blockers are things like Allegra or Benadryl, but the H2 blockers are things like famotidine and those, Pepsid. And what used to be Zantac, it's off the market now, but Tagamet, remember that one?
I do remember Tagamet.
Tagamet caused gynecomastia, so they don't use it very much. So now it's mostly famotidine or Pepsid. And it blocks histamine at the level of the stomach, which is also a signal to the stomach to produce more acid. But I've always told people avoiding carbohydrates will improve acid reflux, and then I don't listen to my own advice.
Yep, it really does.
So I'm going to have to go on a ketogenic diet.
I'll bring you some of my breakfast. I think you'll like it. Yeah.
All right.
I'm going to try that
It's
too.
really good, honey.
Yeah.
I swear it is. It's fabulous.
All right. Very good. So, yeah, if you can limit that and just talk to your primary care. We were all very concerned when proton pump inhibitors were taken away from prescription only and put on the market for this reason, that people would just take them and not even tell anybody.
Right.
All right. You got anything else?
Let's do one more. A question on dehydration and alcohol abuse. What's the average dry out time for someone that hits the sauce pretty hard? How long does it take for the booze bloat to go away? Couple things coming off alcohol, just like cigarettes and anything else, the more you try it, the better chance you have at being successful. Alcohol is 24 to
12 to 24 hours. That's where you can detect alcohol after your last drink with a breathalyzer. And then it's detectable in the blood for about 6 hours, sometimes up to 12 hours. Mm-hmm. But, if you're just talking about you partied too much, we're not talking about abuse. Mm-hmm. You abused it one night, you blew it out your ass, but we're not talking about chronic alcoholism. Then, it's going to take you about 24 hours. Yep. What I've found when I used to drink too much on the weekend or something like that, and I'd have a hangover, and it's you get old enough, and you just don't want to have that hangover anymore. Right. And I would feel like shit the next day, and I would feel anxious and fatigued, and then I would hydrate up, and by the evening I'd start to feel okay, and by the time I woke up the next day I was normal again. So about 24 to 36 hours. And hydrating, what I found, and I'm not advocating this, but this helped me to reduce the hangover syndrome, was I would hydrate up really well before I went to bed, and I would take, an NSAID, like a naproxen, and then I would wake up. So there may be an inflammatory component to it.
Sure.
Seems to be an inflammatory component to everything.
Yeah.
But now, if you're a chronic alcoholic and you quit suddenly, then you can go through withdrawal. That's a whole different thing. And, tremors and seizures and delirium and all that stuff can happen 24 to 72 hours after you quit. And then if you go through, let's say you're a chronic alcoholic and you go through DTs without medical treatment, and sometimes even with medical treatment, but you go through the full withdrawal syndrome, you can get this thing called acute post-withdrawal syndrome that can last up to 2 years. It causes anxiety, depression, sleep problems, all kinds of stuff. It can last for weeks and even months. So don't do that. If you're a chronic alcoholic and you need to stop, there is help.
There are lots.
And you can go to SAMHSA.org. It's SAMHSA, right? Is that right?
Yeah, I believe it is. SAMHSA, yeah.
Yeah, and you can get, the local people who will help you detox. You do not have to do this on your own. As a matter of fact, please don't do it on your own. Get help.
There are, I know, and a lot of times it's free help.
Yeah.
You do not always have to pay. You don't have to spend $1 million a year to go into the Betty Ford.
Right.
There are very talented people that help do these things for free.
Yeah.
And then so just stick with it. And get
you
help.
usually can find some help that's not going to cost you an arm and a leg.
Right.
And there are medications they can use to ameliorate the symptoms and stuff. But I don't think that's what he was asking about. I think he's asking about if you
Just
put on
one
a bender,
blowout,
how long is it going to take? And why are you saying that?
I think it's more chronic from him.
Oh, okay.
Because it's from past questions.
Oh, okay. But so and I have lots of people who are recovering alcoholics, and what that means is they're always an alcoholic, but they don't drink anymore.
Right. It's like
we know a bunch of them who are public figures who have talked about this before. Jim Norton, Dave Landau, other folks like that. And then, we all know people like that too. So it can be done. You can do it. You may need help. And going to a meeting is the first step as well. But going to AA.org and then going to SAMHSA, you can get the help that you need.
You got to get serious about it.
Yep.
Got to get serious. If you're not serious, it's not going to work.
Yeah. Now, Chanda and I were talking about setting up a hydration station outside festivals and stuff so that when people overindulge, you can give them IV fluids, and you can give them some B12 and some other stuff like that, and to kind of help, quote unquote, cure the hangover. That's a different thing altogether. But hydration always seems to be a big part of it.
It helps.
All right. Okie doke. And there was something we were supposed to address, and I don't remember what it was. Okay. All right. Yeah, no proven way to metabolize alcohol faster than the liver's natural rate. So once you've taken it in, and by the way, just drink it. Don't shove it up your ass in an enema or put it under your eyelid or shove a vodka soap tampon in your vagina. Just drink it. If you shove it up your ass, you have no control over the absorption, and people die doing that. So you don't have to come up with novel ways to get drunk. Just drink it. Inhaling it, just stop. Okay? All right. Thanks, everybody. Thanks to Dr. Scott. Thanks, Lady Diagnosis. Thanks to everyone who's made this show happen over the years. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website, drsteve.com, for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody.